Aloha. Okay, today we're going to go over Luigi Mangione again. This is a CNN report on ProPublica reporter uncovering United Healthcare's secret internal cost-cutting campaign. After this, we're going to do breaking points, and then we're going to look at a comedian talking some mess about the whole situation.
The shooting death of United Healthcare CEO Brian Thompson has sparked a national conversation around the frustrations over how the company handles some claims. In a new investigation, ProPublica looked into the claims of one Louisiana mother who says United Healthcare is limiting access to autism therapy for her son. ProPublica reporter Annie Waldman is joining me right now. Annie, great to see you. I mean, you profile a mother, Sherelle Menard, and her son Benji, who has autism. He was diagnosed, as you're right, with severe autism at the age of 3, received treatment, and even the family was celebrating that he would start to speak, a few words, and they started looking at the potential future of Benji very differently. And hoped for more treatment, but that something changed, right, according to your reporting, and then suddenly United Healthcare cuts back on the treatment. And then there was a discovery of some sort of secret internal cost-cutting campaign. Tell us about all of that, because it is a very lengthy and great article that you write. I tried to truncate it there, but fill in the blanks for folks.
Okay, so before she goes, why would you cut insurance for a child? Like, if you have autism, that's something you have for life. If you have type 1 diabetes, that's something you have for life. If like multiple sclerosis, like there's lots of things you could be born with that you will have for life. How could you start cutting insurance or coverage for a child? That makes absolutely no sense.
Yeah, so this year we have done a lot of mental health and behavioral health care reporting, trying to understand how do insurance companies work when they determine what is medically necessary and what's not. And over the course of our reporting, we obtained leaked documents from inside United Health Group by way of their subsidiary Optum, which manages their mental health benefits, that have revealed what is effectively the company's internal playbook for limiting mental health coverage. And in these documents, we uncovered a secret internal cost-cutting campaign that essentially is targeting a growing financial burden for the company, the treatment of thousands of children with autism around the country.
And so
Thousands.
that playbook that you talk about, that was developed by Optum, it was a pursuing market-specific action plans, and among those things, to limit children's access to treatment, specifically autism or particularly challenging conditions. What
Limit
was the
children's
vernacular?
access? Like, that's crazy.
Yeah, so they specifically are targeting children with a diagnosis of autism spectrum disorder, and specifically they're targeting their Medicaid plan. So about 10,000 children are impacted by this. And even though in their document,
Children shouldn't even have to have health insurance. They're kids. They don't have a job. If their parents don't have health insurance, that's not their fault. Like, what? What are you saying? Like, you can just deny kids coverage if they have autism or different things? That's wild.
they acknowledge that some areas across the country have very long wait lists for a specialized therapy to help these kids. The company says that they are actually preventing new providers from joining their networks and terminating existing ones who are already in the network. And what happens is that once these networks become smaller, it is very difficult for families to find clinicians who can provide this therapy for their children, or they have to pay tens of thousands of dollars a year out of pocket for this type of therapy.
So you report Optum, whose parent company, United Health Group, earned $22 billion in net profits last year, is heavily investing in its plan to save millions by limiting access to such
Millions.
care. That's how you reported it. It's pretty alarming. And even in a Washington Post report, someone who worked with United's CEO, Brian Thompson, who was gunned down, was aware of public frustration with some of the company's actions, and that came before his killing. So what's been the response now from Optum or United about your reporting?
Yeah, so United and Optum declined a request that we had and that we made more than a month ago for an on-the-record conversation about their coverage of behavioral and mental health care. We also sent them questions 11 days before our story came out, and they did not respond to them, citing the December 4th killing of United Healthcare CEO Brian Thompson as the reason. In an email, a spokesperson even told us that they were in mourning and could not engage with what they considered a non-urgent story during this incredibly difficult moment.
They're in mourning when they deny healthcare coverage to, one, these autistic kids. I mean, I'm sure it's hard on their parents, and then two, denying healthcare insurance to people who are dying and end up dying, and then their families are in mourning. And how is this not an important story? Healthcare is a very important story.
And in time.
And what has been the response from the Menard family? I mean, how are they now navigating what has become an even more complicated, I guess, health journey for them?
Yeah, what the mother told me, Sherelle, is that if her son doesn't get his therapy, she worries that as he ages, he won't develop the skills that he needs to keep himself safe and help him advocate for himself. So his clinical team, which is based in Lafayette, Louisiana, they are fighting this denial. In fact, they have to go to an administrative law hearing in January to try to get this denial overturned. If it's not overturned, like many families, they may not be able to afford this therapy out of pocket, and Benji will have to scale back the hours.
So their personal mourning.
And this is not just Benji and Sherelle. There are likely hundreds, if not thousands, of families who are dealing with issues with insurance companies trying to get coverage of this type of care.
Annie Waldman, glad you could be with us. Of course, folks, if you want to read the ProPublica story reported by Annie.
So now this is going to be Breaking Points, Saga and Crystal, Saga and Jetty and Crystal Ball, talking about Luigi Mangione. And this is a 25-minute clip, so we're probably just going to do the first 10 minutes or so.
All right, let's go ahead and get to some updates with regard to Luigi Mangione and the media reaction in particular. Those extraordinary segment on Fox Business where they took great issue with the comments that both Bernie Sanders and Elizabeth Warren have made, basically saying, listen, of course, murder is wrong. We all know that. However, you have to understand the public reaction and how they see the healthcare system as itself being violent, cruel, and evil. In response to this Fox Business, I guess, what is Joe Concha? He's a contributor there?
Concha?
Yeah.
He's like a media
contributor.
Yeah.
Anyway, media critic, whatever. Analyst was brought on to call for their resignation over these comments. Let's take a listen.
This absolutely makes my blood boil, Liz, and I'm sure that's true of anyone sane and sober who advocates a civil society. These are, including Elizabeth Warren, Bernie Sanders has had the same sentiment. 2 U.S. senators that we're talking about, they've been in office for decades, and they think that shooting a father of 2 boys, a husband in the back like a coward on the street, like this 6'6" person, Luigi.
Would have been better if he shot him in the face?
Mangione did last week. They're saying that, Brian Thompson, the CEO, had it coming somehow?
They didn't say that.
Both should resign from the Senate for this rhetoric. They are begging copycat killers to come along and start taking out other CEOs or anybody in a position of power whom they disagree with or whose industry they disagree with. Every Democrat on Capitol Hill should be asked if they support or condemn this ridiculous, reckless rhetoric. The same kind of rhetoric, Liz, by the way, that Democrats used that nearly got Donald Trump killed twice, including once on national television. I mean, look, I thought that Obamacare was supposed to bring down the cost of health care and premiums, and the opposite has happened. Are we going to hear criticism from Elizabeth Warren about the architect of Obamacare or the president it was named after? Doubtful.
Probably,
Liz Warren and Bernie Sanders should be shamed into oblivion for this. Actually,
they talk about our healthcare system all the time. I mean, yes, they talk about Obamacare and shame it or whatever he said.
Every member of the media, by the way, that is turning this lunatic into a sex symbol. It's nauseating as a father.
Go to the gym, homie.
A human being.
So to state the obvious, analysis of the public reaction is not the same thing as advocacy for murder, quite clearly.
Right.
Number 2, hilarious for Republicans to pearl clutch over violent rhetoric when, of course, Donald Trump was out there calling for the military to be turned on his political enemies. Number 3,
and then, what's his name? Tucker Carlson, he talks about stochastic stochastic terrorism is not real. They all say stochastic terrorism isn't real. They all talk that harsh rhetoric and say people have their own mind and do their own thing. I was trying to find Tucker saying that, but I couldn't find. I can only find people talking about him being a stochastic terrorist.
ATS Tucker, that Bernie Sanders in particular, but also Elizabeth Warren, haven't been critical of Obamacare is kind of preposterous. And number 4, there's a later part in the segment, which it was like a 5-minute segment, so we don't want to play the whole clip, it's just too long, where he starts going off on AOC too, and he's like, why don't these people offer solutions? It's like, they literally have been offering you may not like their solutions, but Medicare for All is a solution that they have been pushing for, Bernie Sanders in particular, for probably literally decades at this point. So whole thing is just fake outrage over, what has been a mass reaction against the healthcare industry in the wake of this killing.
So I think there has been a mass reaction. I think I guess I'm just starting to get skeptical that this is, having lived through some leftist, justifications for violence and others, there generally seems to be an overestimation of quote unquote how much the public is with you. So just because something is viral on TikTok or elsewhere, I mean, BLM was viral on not TikTok, social media or whatever at the time, but people publicly turned against it. So I'm not saying that the quote unquote rage and all of that isn't there, but I also am a little bit skeptical that people are full blown like, yeah, I'm actually like genuinely happy that this person has been killed.
Oh, I'm not saying that.
No one said they were happy that he's been killed. We're happy that we're having this conversation now, or more deeply, but no one said they're happy that he's killed.
But I mean, for example, there's this theory like you just laid out that people are like crying out for universal health care. But if you look at the statistics, I mean, the vast majority of people are quote okay with their own healthcare plan or coverage. I don't agree with that. I think your healthcare plan coverage, et cetera, is way too expensive, is bad. People mostly have affinity for their doctors. I mean, a small portion of the US public, some 30 to 40 million, is genuinely like destroyed by the US healthcare system.
Yeah.
I think those are the people who probably have been speaking out against this. But I also don't think we should overstate the case of like what all this is. Like if the people truly cried out for universal healthcare, I think they would get it. And I just genuinely...
That is not true. We got that video that shows no matter what you want, 30% of what you want and what you don't want gets passed. It's more what the rich people want.
I don't think that...
You think we live in a democratic system where people get what they want when they support it popularly? Because that has not been my experience. I mean, if you think back even to the 2020 primary, right? Bernie Sanders is running on Medicare for All.
Yeah.
Every poll showed that large majorities of Democratic voters, even in states like Mississippi, supported Medicare for All over maintaining the current system. However, they backed Joe Biden because they were convinced that he was the only person who could beat Donald Trump, and they were convinced by the electability argument. There was a recent polling, I think from Gallup, that showed the highest level in recent years of people saying that they believe it should be the government's responsibility to provide for universal health care.
That's not the same thing as Medicare for All, though, and that's the
but I'm not saying exactly, but I mean that is a commitment to this should be a human right. Healthcare should be a right and not a privilege. But
who's to say what a right is? I do think healthcare should be a human right, but is food a human right? Is shelter a human right? People can't live without food. People can't live without shelter, and that all comes before healthcare, right? If you don't get no food, you don't need healthcare because you ain't gonna live. But is education a human right? I agree, and I think all those should be. But like to her point, or my question to her is, what are human rights, and are all human rights? Should all human rights be taken care of by the government?
I do think even if you look at the polling in this election, neither candidate ran on healthcare. I mean, outside of like, oh, we're going to lower a few prescription drug prices or whatever, that was it. Healthcare has been completely excised from the national political conversation up until this moment. But even with that being...
It has not. It was a big thing in 2020. It was a big thing in 2016. Healthcare was a huge part of Bernie Sanders' campaign on both those years.
Being the case with neither political party really pushing the issue, you still had people ranking healthcare reform as one of their top issues.
She's going to say all this to not mention the Green Party, not mention the Democratic Socialists of America, not to mention anybody else. She's just going to push Democrats over Republicans, which are pretty much no different. Neither one, like she said, is going to bring up health care. Bernie Sanders, who's an independent that ran as a Democrat, he brought up health care. But outside of that, They're not going to bring up healthcare. They're not going to do anything for us. And she's not going to bring up these other parties until 2028. She's going to be like, oh, well, they're not viable, so let's not vote for them.
It clearly is a system that causes a great deal of pain. Now, you're right. Do you want to take, what happens on Twitter as always real life? No. But the fact that you had this same reaction across every single platform, I think definitely tells you that there is some there. And there was actually polling that came out, we didn't include it in this segment, but some pretty extraordinary polling, especially of young people, where Luigi Mangione, the killer, has a higher approval rating than healthcare in the United States, health insurance companies, and Brian Thompson, who's the slain CEO.
I know, but this is part of the problem with the cherry picking stats. Like Congress has a 13% approval rating. 90% of people approve of their member of Congress. Right? So the point is that it's complicated in terms of how it actually manifests.
So you think people are actually satisfied with Congress?
I think people like their congressman or delude themselves into thinking that their particular congressman is the good one. It's all the other bad ones that are it's like doctors. I've talked about this before. Everyone loves their doctor. Nobody wants to talk about why our doctors are wildly overpaid. Sorry, docs. I know you'll crucify me for that one, compared to every other developed.
Of all the things, talking about doctors overpaid, did he tell you the CEO was overpaid? That CEO made $10 million last year, and then he got to sell off $15 million in stocks one day.
Country in the world. Like, this is the thing.
And he was getting sued for selling that $15 million of stocks. You can talk about doctors who save lives, make too much. Of all, in all the healthcare part, that's probably the least worrisome part is doctors making a lot of money.
Is that if you actually dig into it and you look, all right, even coming back to the universal health care point, like you just talked about, the government has a responsibility. That's not the same thing as a single payer system. Right now, if you look at faith in our medical system, public health and others, after you've just gone through COVID, how could you want the government to take over universal health care? That's insane, considering the amount of bullshit that they talked and lied to us for over 5 years. If anything, America's become way more libertarian whenever it comes to health care.
You want big pharmaceutical
This isn't about what I want.
With a
this is about how
for-profit
people are
motive and health insurers with a for-profit motive. I mean, if you just look at our system compared to, listen, I'm not saying that every other country with universal health care where it's perfect and nobody has any complaints, but the cost is lower, the care is better, and people live longer.
I agree.
Like, it's very clear. And is it a universal sentiment in favor? No, of course not. But I think it's pretty undeniable at this point that this moment has struck a chord with people because so many Americans have had some horrible experience with the healthcare system and do experience it as effectively cruel and terrible and inhuman. I mean, it's just at its core, like putting profits over actually caring for people when they're ill, making sure they get
what capitalism
what they
is.
need. That is an immoral system that we have set up. And yes, I think that millions and millions of Americans
we put profits over people's health care. We put profits over people's housing. We put profits over people's food. We put profits over people's education. We put profits over people's cars. Anything, name it, clothes, anything you can think of, drinks, whatever you want to buy. We put profits over the people. If you can't afford it, you can't have it.
Experience it as such, and that's why they're reacting to it. So to, just dismiss that, I just don't agree.
I'm not
with that.
dismissing. I don't want to overstate it. I think it's trendy and it's cool right now to talk about Luigi Mangione. And look, it's funny, all right? Like, as somebody who's been on 4chan since literally a teenager, I understand dark humor, etc. It doesn't bother me, all right? Like, if anything, I'm laughing right there with you. But I'm not going to overstate the case as some sort of mass social movement. I just think it's a lot more multifaceted than a lot of people who want quote unquote universal health care believe. Trust in government is an all-time low, trust in institutions. I mean, the vaccine rate is now falling. I think the flu shot had the lowest uptick literally ever in modern American history. The number of people who are choosing personal exemption and are outwardly flouting government guidance is higher than ever. I don't even think any of that is necessarily a bad thing because people are asking questions for themselves.
But that doesn't comport.
But that's not. But yeah, okay. Old people like when Medicare pays their bills, but they don't like whenever they get told what to do.
But that's what
mostly
Medicare
what it comes down
for
to.
all would be. It's not.
Okay,
that's what Medicare for all. That's.
Again, they pay your bills, but normally your doctor's going to tell you what to do anyway. Do you know what you're supposed to do when you have a knee replacement, or that's why you go to the hospitals to be told what to do? Oh, my chest hurts. Check it out, and they tell you you have this, that, and the other. You need to do this. You want the doctor to tell you what to do.
The proposal for Medicare for all is just to expand Medicare, already a very popular program, And Bernie's plan specifically would just continuously lower the age until you have everyone covered by Medicare. Much lower administrative costs, much better outcomes, in line with what many other countries have done. So it's not like you're going to be going to like your government-issued doctor. Although I will also say that the VA healthcare system is also much better than the private healthcare
You're
system
certainly,
as well.
listen, I don't disagree about.
If you have Medicare for all, if you want to say that doctors are government issued, then all doctors will be government issued. It'll be your doctor, my doctor, and every other doctor. The doctors that are doctors now will just be called government issued now.
Health outcomes, etc. I just don't think we live in a society that can tolerate this right now. I mean, I can talk about Japan all day long, but
tolerate what?
That can tolerate like literal government administration, rationing, and so that like in Canada and the UK.
Rationing your care. We ration our care now just by money. If you ain't got no money, you don't even go to the hospital.
These are baked in social programs from World War II onwards.
People tolerate
75
Medicare
years.
just fine.
Yeah, people tolerate, quote unquote.
They love Medicare.
Again,
and Social Security.
They like
universal programs are very popular.
They like it when the government pays their bills. They don't necessarily like it whenever they're being told what to do, or when they're rationing care, or whenever we had there was huge COVID outbreaks in a lot of these Medicare nursing
what
homes.
do you think that the best solution would be?
If you ask me about solution, I think we should have universal coverage, not necessarily single payer. I think there's certainly every American should have access to low-cost health care, but a lot of people will not like what it takes to get there.
Is that like a public option?
I'm not really sure. I mean, really, it's about democratic, because the point is that we need to have sure that people have coverage. We also need to break up and destroy a lot of the cost vectors, which is private equity hospitals, which is doctors, the American Medical Association, the fact that our people are getting 5 times more salary than the average doctor in Europe. It's outrageous.
He's really on his doctor thing. Like, he doesn't want doctors to be making money. But CEOs is good to make money, right? So as I said, I'm all for universal health care. I think that's what it should be. We just pay our taxes, we go to the hospital, we get our stuff done. And we're about to go to some jokes. We're just going to end off with the stand-up by Dan Pan. That's his name.
Was anyone else rooting for this guy to get away?
I was.
From day one, as soon as they put out the public request for help, I started calling into that Crime Stoppers thing. Click, 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 click. Hello? Yes, I have some critical information for you about the case. You guys are gay. Click!
Okay, I've been trying not to stop this, but I've been trying to let it go. But you know what would have been cool? I don't know if it would have been cool or not, but if everybody would have done that, right? Just called in and been like, oh, he's here. And just had all the cops going to all these different places. Maybe go use payphones if you do that. But that would have been so crazy if all of America, just people from every city was just calling in saying, he's here, he's here, he's here, and just had him just running around.
And plus all the evidence he had on him. All the evidence. They found the murder weapon, the same outfit, the exact same IDs, and a manifesto confessing what he did? What else did you plan on him? Did he have a selfie where he took a picture with the CEO's dead body? Like, check this out. Didn't want to believe it. Didn't want to believe it. But then I started reading the suspect's social media. And I was like, yeah, that's probably him. It's probably, they probably got him. Look, when it comes to these public shooters, usually when they leave like manifestos, it's very like messy, right? Like there's a lot of random crap in it that's just mostly incel garbage. But this guy, he was a high school valedictorian. He got into an Ivy League school and he has a BA in engineering. This guy knows how to write an A+ essay. I was reading his social media. No spelling errors, no punctuation errors, nothing. Just a pleasure to read. One quote of his that's really going viral right now, he's talking about the environment. And he talks about how oil tycoons really, they don't care about us. How many years has Greta Thunberg been peacefully protesting, and what's been done?
Right.
Nothing. At what point, these guys are burning our planet down. At what point does violence become necessary self-defense?
If you want to learn how to edit really well from professional Hollywood, I'm talking about real creative skills.
At what point is Greta Thunberg gonna get out there with her AK-47, guns with Greta, and just start you know. Look, I'm just kidding. I obviously, I don't condone violence of any kind because I don't want to get demonetized on YouTube.
Right.
But I will say,
I'm trying to get monetized.
That this Luigi guy, he is very well written, and he's obviously a very intelligent individual. But it seems his greatest weakness is women, because this guy went to great lengths, was very patient, kept his cover for an entire 2 weeks while planning, carefully prepping his assassination. And the reason they caught him is because a woman was flirting with him at the hostel and he smiled. And that's why I think he turned himself in. Because he saw all the memes of women posting how hot he was online and he was like, oh no. Luigi, be strong. It's not worth it. They're gonna Jeffrey Epstein you. Don't turn yourself in. Oh, they're posting things like, I can fix him. Oh no, I can't. Fuck it, let's roll the dice. Does anyone else think that it's just fucking hilarious that his name is Luigi? I read one comment on social media that said, imagine getting killed by player 2. My brother Mario, he's so sick. He's a doctor, but he can't treat himself. A lot of people are saying that this Luigi guy, he's not going to inspire others because all CEOs are going to do is they're going to bump up their own security. Which is true, but, you know, at the same time, like, Donald Trump, he has the Secret Service protecting him. And he almost got taken out by a 20-year-old Discord mod. So I don't care how much security that you have, you're always going to be at risk. Plus, these companies, they're capitalist companies. They want to make as much money as possible. And so they're probably going to like downplay the security detail at some point, right? Like, okay, well, like if you're a CEO, we'll start you off with real security. But if you're like the CFO, maybe we'll give you like a mall cop. If you're the CTO, we're just going to give you like strip club bouncers. You know, you make do with what you got, right? I hated the way the media has been absolutely dog shit in the way that they've been portraying him. It's very obvious because most mainstream media companies are owned by billionaires, and billionaires do not like getting shot. So they've been really downplaying this story as soon as it was out there. Like in the first few days, if you watch the coverage, it was very, very tame, very timid. They just talked about like the wife and the coworker's statement, how devastated they were. Oh, we're so devastated. We miss him so much. He was so beloved at work. Everyone liked him. So? He ran United Healthcare. They have the largest claims denial of anyone else in the industry. They are known for killing people for profit. Who cares how nice he was to his coworkers? Like what? Oh, Hitler killed all those people, but he always brought donuts in on Wednesdays. Here's why this thing will not die. It's because of the media.
That was pretty funny.
It's because of the media. They created this landscape before us. Remember the first time Columbine happened? And everyone was shocked. They were horrified that something like this could happen. And what did the media do? They reported it. They kept reporting it. And they continued to make it a spectacle. And healthcare experts said, please, please, please stop reporting it. You're going to create more copycats. We're going to have an epidemic of school shooters because you guys are making it such a big deal. So what did the media do? They ran a story about the man's imaginary girlfriend. Yeah, because apparently that was critical information that the public needed to know. A lot of women have been posting about how hot they think he is. And I gotta say, they are absolutely right. He is a smoke show. I mean, he is jacked. I thought about what it would be like to go on a first date with Luigi. I don't think he would be very popular in real life. Because this is a man with very strong convictions. And men like that generally are very intense about their beliefs. So if you go on a date with this guy and you sit down with him and you're like, Luigi, what's your favorite book? Mine's Harry Potter. What about you? Have you read Delay, Defend, Deny? The way the American healthcare industry is destroying our people? No, I haven't seen that one. Well, there's a documentary about it too. You should look it up.
That was pretty funny. So yeah, a little bit more news on Luigi Mangione, and then a little bit of comedy to follow. All right, until next time, guys, stay informed and have fun.